Now that one healing place is completed and patients are receiving the best cancer care treatment in the Big Bend region, TMH has set out to fill another healthcare void, a comprehensive neurovascular center with the ability to offer both open and endovascular procedures. Here's Judy Greenwald to tell us more. Hi, Judy.
Hey, Kristen.
So what's been going on in this area that has made this a top priority?
Those patients that were in need of complex neurovascular services were having to be transferred to medical facilities that were like 2 and 3 hours driving distance. And those patients, most of those patients were actually having to be life flighted to those facilities.
And what do you anticipate will be the need for such a center in this region?
This past year, we actually had between 75 and 100 patients who had ruptured aneurysms that had to be transferred to those facilities that were located 2 to 3 hours driving distance from our area. And what that means for the patients, once they go to those facilities and have a complex neurovascular procedure done, they usually have to stay 14 to 21 days as an inpatient. And that's a long time to be away from your family and the community. What we're planning is to build a neurovascular suite at Tallahassee Memorial Hospital. But we really could not execute that plan until we had our quarterback come on board, Dr. Matthew Lawson. And we are now have built a beautiful state-of-the-art neurovascular suite, which will be able to offer treatment options for those complex neurovascular patients as well as diagnostic procedures.
Sounds to me like you have met your quarterback.
Absolutely.
In order to learn more about the neurosurgery team here at TMH, Dr. Lawson has agreed to talk with me in his office. Thank you so much for your time. Now, I understand that you are new to the team here in neurosurgery. Why is this a really appropriate time for you to be joining on?
Well, this is a great time for me to join the team here at Tallahassee Memorial Hospital because the hospital has taken a huge step forward in adding cerebrovascular surgery to its services offered, and that's my expertise, so it was a great time to join this institution.
Now, you said cerebrovascular surgery. What is that exactly?
Well, cerebrovascular surgery traditionally was open surgery performed by a neurosurgeon where they'd make an incision on the head and go through the skull to treat disorders of the blood vessels of the brain, such as aneurysms or AV malformations. But really over the last 15 years or so, there's been a dramatic rise in endovascular neurosurgery, and that's what I've been trained in. And that includes treating disorders of the blood vessels of the brain from inside the artery. So it's a minimally invasive approach to the same disorders.
So is that the primary benefit then, the minimally invasive approach?
Absolutely. With traditional surgery, there's a large incision, there's exposure of the brain tissue to get down to the blood vessels that are being treated. With endovascular therapy, many times we can treat those exact same disorders from the inside, sparing the exposure or trauma of traditional surgery.
And do these procedures require new technology then for TMH?
Yes, these procedures are performed in an endovascular suite that we just built here at the hospital, and it's a very capital-intensive process. It's been under construction for a while, and we're very happy that it's open and running.
And the end goal then is a comprehensive stroke center?
Yeah, the goal here in the next year is to have a comprehensive stroke center where we can provide 24/7 around-the-clock coverage for the treatment of acute stroke. We can assess those patients quickly in the emergency department, provide medical therapy, and then if needed, take them quickly to the cath lab for intervention on their acute stroke.
Well, that's incredible. Thank you so much for your time and good luck in your new position here. I have to say, I'm always impressed with TMH's commitment to technology.
Thank you.